Hello, I'm Dr. Sandra Fryhofer, liaison to ACIP, the CDC's Advisory Committee on Immunization Practices. Welcome to the American College of Physicians 2024 Adult Immunization Video Series. The topic, Vaccinating Adults Against Respiratory Diseases. The latest updates for flu, COVID, RSV, and pneumococcal vaccines. Let's start with flu. Everyone 6 months and older needs flu vaccination every year. This universal recommendation hasn't changed. The best time is in September and October, but continue vaccination throughout the season as long as flu viruses are circulating. The newest flu news is for those with egg allergy, and it's not which vaccine they can get. Those with egg allergy can get any age and health condition appropriate vaccine, either egg-free or egg-based. What's new is where they can go to get their vaccine. People with egg allergy no longer require additional safety measures beyond what others would get. And as a reminder, for adults 65 and older, the higher dose and adjuvanted flu vaccines are preferred. All flu vaccines are now quadrivalent, meaning they cover 4 strains, 2 flu A's and 2 flu B's, but that may soon change. FDA's Independent Advisory Committee, VRBPAC, unanimously endorsed removing the Yamagata flu B strain because it no longer appears to be circulating. The World Health Organization agrees. FDA will make its final decision on next year's flu vaccine composition in February or March of 2024, so more to come. Moving on to COVID. COVID's now endemic. It seems it's here to stay. A dose of the updated 2023-2024 COVID vaccine is now recommended for everyone 6 months and older. This is also a universal recommendation, just like the one we have for flu. For those age 5 and older, a single dose is all you need, regardless of previous vaccination status and even if you've never had any previous COVID vaccinations. Those with immunocompromising conditions who've had a 3-dose mRNA prime also need an updated dose and may need additional doses if recommended by their physician. More details are to come on need for additional doses for other high-risk groups. We know adults 65 and older and those with multiple underlying medical conditions are at greatest risk of severe outcomes, but there is no group that clearly has no risk from COVID. A dose of the updated vaccine can be given at least 2 months after your last COVID vaccine dose. And if you recently had COVID, you can wait 3 months after infection to get the updated shot, or get it as soon as you recovered and no longer in isolation. Another heads up, at the September ACIP meeting, CDC said evidence is accumulating that previous vaccines and boosters may reduce risk of long COVID. Next, RSV. RSV season typically runs from October through March, and now, for the first time ever, we have 2 vaccines to protect older adults and 2 new ways to protect little babies. A maternal RSV vaccine given to mom, and a new long-acting monoclonal antibody given to baby. There are 2 RSV vaccines. Both are RSV pre-F vaccines, which is why we have to differentiate them by name and manufacturer. One by GSK called Arexvy contains an adjuvant, the same one that's in the recombinant shingles vaccine Shingrix. The other RSV vaccine, Abrezvo, made by Pfizer, does not contain an adjuvant. Both are extremely effective at preventing serious illness in older adults. Both have now been recommended by ACIP for those age 60 and older under shared clinical decision-making, meaning you and your patient have to discuss and decide. Nearly all adults hospitalized with RSV have at least one underlying medical condition. More than 60% have 3 or more. But there are important safety signal concerns that need a closer look. 6 cases of inflammatory neurological events were observed in vaccine trials for older adults. There was also an imbalance in cases of atrial fibrillation. FDA is requiring post-marketing surveillance for both conditions from both manufacturers. RSV is also the most common cause of hospitalization for infants in the United States. and just about every child would have had it by the time they're 2 years old. Pregnant people now have a choice in how to protect their babies. They can either get a dose of maternal RSV vaccine themselves at 32 to 36 weeks, or their baby can receive a dose of this new long-acting monoclonal antibody, nirsevimab, after delivery. A single dose of it will last the entire RSV season. But understand, only the vaccine without the adjuvant, brand name Abrezvo, can be given to pregnant people at 32 to 36 weeks, and only to those whose babies will deliver during RSV season. Babies born to those who did not get vaccinated can receive a dose of nirsevimab. Both products are safe and effective. We'll end with a final reminder about recent updates for pneumococcal vaccination. This is also under shared clinical decision-making. Adults 65 and older who completed their pneumococcal vaccination series with a PCV13, then PPSV23 combo at least 5 years ago now have the option of getting additional protection from an additional pneumococcal vaccine dose, a dose of PCV20, Prevnar 20. This helps ensure durability and broad vaccine coverage. Here's why. PPSV23 is a pneumococcal polysaccharide vaccine. It's made from capsular polysaccharide antigens. PPSV23 is T-cell independent. Polysaccharide vaccines do not trigger production of memory B cells. PCV vaccines are pneumococcal conjugate vaccines. Their capsular polysaccharide antigens are conjugated to a protein carrier. Conjugate vaccines are T-cell dependent and do produce memory cells, and this means greater duration of protection. The goal of pneumococcal vaccination is broad coverage and durable protection, and that's why the recommendations have been refined. PCV20 still rules for simplicity and broad coverage for those with chronic medical conditions, CSF leaks, and cochlear implants, and for those with immunocompromising conditions, as well as for those aged 65 and older. But there's still the sequential combo option of PCV15, then PPSV23. Remember, there's concern that PPSV can blunt the immune response to PCV. That's why PCV should ideally be given first. CDC says all these vaccines can be co-administered together and with other vaccines. So there you have it, an update on vaccinating against respiratory diseases, 4 vaccines to know about, and if indicated, recommend and receive. For more details, check out our vaccine-specific video segments on RSV vaccines and the updated COVID vaccines. For the American College of Physicians, I'm Dr. Sandra Fryhofer.